as we have highlighted in this case, fatigue is something that happens. I have not encountered an anti-neoplastic regimen that does not cause fatigue, unfortunately. So discussing fatigue and management of fatigue and emphasizing that activity is important in sort of combating treatment fatigue is important. So that's clearly one issue that I think has to be discussed. But the BRAF-specific targeted therapies have some unique features that I think is worth highlighting, and that's the fact that many patients develop photosensitivity, particularly if you use the so use of sunscreen and things like that are important. Maculopapular rash can happen, but in particular, this patient population can suffer from this side effect that's been labeled as squamo-proliferative lesions. Basically, patients can develop skin cancers, squamous cell carcinomas of the skin, and keratocontosis. So these are typically the kind of side effects that leads me to ask our colleagues in the dermatology division to see these patients along with us for routine checkups and management of these squamous cell carcinomas of the skin that might arise. So this seems to be related to the MEK pathway, and again, it's one of the things that, at least in my practice, I encourage patients to have a visit with a dermatologist initially for a routine general check, and then have regular follow-ups so that when these lesions do come up, they can be managed appropriately, and most of them can be managed by small incisions. But again, as I said, this is a sort of a unique feature that we see in our patients that are treated with the targeted therapies for BRAF V600.